Welcome to Cultivating Equality Stories of Women and Men, an audio learning program funded by Fives. Cultivating Equality was developed to raise awareness and promote understanding of gender equality in the company's operation, including both staff and suppliers. Each chapter will be an opportunity to learn about gender equality and business. As we move along, you will discover the opportunities that arise when we cultivate equality. Prepare to learn and grow together in our audio learning program. Welcome back. Today, we're breaking the silence on a topic surrounded by myths and misinformation. Sexually transmitted infections, STIs. What are they? How can you prevent them? And why does misinformation keep them spreading? To give you the facts and bust the myths, we're joined today by Alisha Solis-Augustine, registered nurse, midwife, and supervisor of the Maternal and Child Health Program in Stann Creek, Belize. It's time for honest, clear, and essential conversations. So let's get started. Nurse Alisha, welcome.
Thank you, Carolina.
Alisha, what is the first step that all men and women should take to maintain a healthy sex life?
Well, the first thing men and women should do is to visit the specialist at least once a year. For women, after turning 20 years, and especially if they're sexually active, they should get a pap smear done at least once a year to test the cells of the cervix and detect or rule out the presence of abnormal cells, cancers, or vaginal infections. After age 40, all women should have a mammogram to check for breast cancer every 2 years. However, if there is a family history of breast cancer, then we would recommend that that woman come in every year and not every 2 years. From the first period, women should learn and practice to check their breasts themselves. So the breast examination, self-breast examination, which combines with a physical and visual examination of the breast to check for signs and symptoms of breast cancer. This self-breast exam allows us to become familiar with our breasts by looking and by feeling. It will also help us to identify any changes or abnormality, such as lumps or even the changes in our skin. If anyone discover any abnormality or anything new, they should report to their doctor or their midwives immediately. While most breast cancer occur in women, men should also be on the lookout for breast lumps, breast skin changes, bleeding, or nipple discharge. If you have any of these, consult your physician immediately. Men, especially ages 20 and 40, should perform a monthly self exam on their testicles to find lumps or masses or to identify if there is pain. And the best time to perform this is during a bath, while wet and soapy skin makes it easier for them to check their testicles.
Alicia, what you're referring here is super easy to do. It doesn't cost anything. It's just basically getting to know ourselves better, to identify when we're healthy, and to identify early on if there are any changes. And if those changes happen, then we should all go to the doctor. What other risks are there for a healthy sex life?
Another very frequent challenge of sexual health is sexually transmitted infections, which are passed on from one person to another through sexual contact, whether vaginal, oral, or anal, or any contact involving these body parts, or by a blood transfusion, or sharing or reusing needles. There are even some infection that can be transmitted from mother to child during pregnancy, childbirth, or breastfeeding. Hence the reason our surveillance in maternal and child health department, we do have a very effective program in the prevention of mother to child transmission when it comes to HIV, syphilis, and hepatitis B. Carolina, did you know that there are more than 20 types of sexually transmitted infections?
Wow, no, Nurse Alicia, that sounds like a lot. What are the most common ones?
The most common sexually transmitted infections are chlamydia, gonorrhea, syphilis, candida, and trichomoniasis. Depending on the type of infection, it may produce one or even more of the following symptoms, including unusual discharge from the penis or vagina, sores or warts in the genital area, painful or frequent urination, itching and redness the genital area, blisters or sores in or around the mouth, abnormal penile and vaginal odor, anal itching, pain or bleeding, abdominal pain, and fever.
So, if any of the people that are listening to us right now have these symptoms or their partner has them, what should they do?
Please go to the doctor and avoid any sexual contact with anyone. If you have several sexual partners, report the situation and suggest that they also get tested or a routine medical checkup. If you are given treatment, do it as direct. And before resuming sexual contact, ask the treating physician to test to take a test again and confirm that you're free of the infection.
Can any of these sexually transmitted infections cause death?
Yes, Carolina, the human immunodeficiency virus, better known as HIV, which causes acquired immunodeficiency syndrome, initially known as AIDS, although today we refer to it as advanced HIV, this weakens the body's protection against infections. Unlike other STIs, in the early stages of HIV presents a series of symptoms that can easily be confused with other diseases and which, because they are neither very painful nor disabling, go unnoticed, such as fever, sore throats, muscle and joint pains, small bumps around the neck or armpits, rashes on the chest and face. Later, other symptoms can occur, such as nausea, vomiting, diarrhea, weight loss, eye, mouth, and lung infection. And in the final stages, the body fails to detect itself against infection and illnesses, become more frequent and aggressive, and this can lead to death. There is currently no cure for HIV, but treatment or antiretroviral focuses on damage control.
These STIs do not always have symptoms at the beginning, or they even cause mild symptoms, right? This means that it is possible to have an infection and not know it, and that it can be transmitted to the other people with whom we have sex or sexual encounters. Now, the $1 million question, Nurse Alicia, is can sexually transmitted infections be prevented?
The good news is yes, the safest way is no sex at all. But if you decide to have sex, you can reduce your risk of getting an STI by testing you and your sexual partners for STIs before even engaging in sexual activities and after that ongoing or sporadic basis. Use a condom for each sexual encounter, including during pregnancy. There are external condoms that are placed on the penis and internal condoms that are placed inside of the vagina. Reduce the number of sexual partners. Very, very important. Get vaccinated against human papilloma virus and hepatitis B. I must add that both vaccines are available at all our facility in the Stann Creek district at the Maternal and Child Health Department.
So, Nurse Alicia, putting on a condom is super easy and simple and even inexpensive. And yet, there is an enormous resistance based on false beliefs. To explore those barriers, we have 8 guests who will share their beliefs, and then you, as our sexuality expert, will respond. So, let's get started.
To be honest, condoms kill the vibe and take pleasure away.
The condom does not reduce pleasure. When the couple agrees on a contraceptive method, sex is much better because they both focus on pleasure and not worried about infection or unwanted pregnancy. If you feel any discomfort, check your condom size, make sure it is being used properly, and use the right lubricant.
Imagine this. My husband is so big that the condom doesn't fit.
There are different sizes of condom for all penis sizes. Which one is right? The one that slides easily and stays in place.
I can't wear a condom because I'm allergic to latex.
Don't worry. There are condoms made of polyurethane that are just effective. Enjoy a wonderful sex life with or without latex.
It's way better to use 2 condoms. Then nothing happens, neither pregnancy nor infection.
2 condoms only increases the risk of breakage due to friction and improper fit. Use a condom during the entire sexual encounter, not just during climax, because you may share fluids beforehand.
If you don't have a condom, put on any plastic bag or kitchen plastic wrap. After all, it's the same thing.
Plastic offers no protection. The latex or the polyurethane condoms is not replaceable.
Don't worry, condoms can be lent or reused, and it works just the same.
Do not wash, reuse, or lend your condoms. Recycling applies to many things, but not this.
I don't use condoms because I only sleep with good people.
Sexually transmitted infection do not have an opinion on whether or not you are nice, good, or promiscuous.
Rest assured that if he didn't come, there is no chance of catching something strange.
Sexual contact with or without penetration and with or without ejaculation can cause bacteria, fungus, or virus to spread.
Now, to wrap up this chapter, I would like to ask you for the key messages you would like to transmit to our audience right now.
All right. Every woman who is sexually active, remember, get tested. There is pap smears are available, VIA are available. VIA is another form of screening for cervical cancer, which include visual inspection with acetic acid. These are all available at the Independence Polyclinic and all our surrounding areas in the Stann Creek district. HPV testing is also available. That is the test for human papilloma viruses. For men, check your testicles. Also, check your breasts. Breast examination is not only a screening that should be done only for women. Remember, reduce the number of sexual partners. Use a condom each and every time you have sex. Get tested and screening often. And lastly, please note that we will be visiting our farms to offer HIV testing, syphilis testing, and hepatitis B testing. We will also be offering pap smears, HPV test, and VIA testing screening as well. Feel free to come out. All these tests are free.
Nurse Alisha, thank you for setting the record straight and for showing us how these false beliefs really have more scientific information that allows us to have a better and more pleasurable sex life.
Thank you, Carolina. It was my pleasure, and thank you again for having me on this audio learning program.
And that's a wrap on our second chapter on sexuality. Before we go, here are 3 key takeaways. First, your sexual health is your responsibility. It's about self-love. So women, get serious with your annual pap smears and do a monthly breast self-exam. And men, check yourself 1 testicular self-exam per month. Second, safe sex is a shared responsibility. Educate yourself. Protect and respect yourself and your partner. Third, condoms are your best defense. They prevent STIs, reduce pregnancy, and we have a golden rule. 1 condom per sexual encounter. No exceptions. And now I farewell you with the phrase of the Englishman John Gray. Diseases are the interests paid for pleasures. And I would add, in the context of this chapter, that sexually transmitted infections and diseases are the interest of sexual pleasures lived without responsibility. Thank you to each and every one of you who is listening. Infinite thanks for your time. Infinite thanks for your attention. And see you in the next chapter, where we will continue to cultivate gender equality.